If you are a New Jersey resident, are you now going to be subject to more prior authorizations if you are on Medicare? There's been a lot of hubbub and a lot of noise about this new WISER program that Medicare is introducing in 2026. We're going to go through all of it without any fear mongering, without any hyperbole. We're just going to give you the facts so you know exactly what to expect if you are a New Jersey Medicare enrollee. And if you want to work with brokers who stay on top of news like this, work with the people here at NJ Life and Health. More on us later, but let's dive into the article. New Jersey has been chosen as one of 6 states to be part of a pilot program with Medicare called WISER. Now, the whole point of WISER is that it's going to add prior authorization requirements to 17 procedures for people in New Jersey who are on original Medicare. So the scope of this is small. There's been a lot of articles talking about how prior authorization is being added, and it kind of seems like a blanket statement. It's actually a very small rollout initially. So we're going to talk about what this means for you. So WISER explained, in an effort to curb waste, fraud, and abuse in original Medicare, CMS has created the Wasteful and Inappropriate Service Reduction Model, otherwise known as WISER. It's going to be combining AI technology with actual physicians to determine if certain procedures are fraudulent. Now, there's 2 pieces to this. The first is there is a lot of Medicare fraud, waste, and abuse out there. It is tens of billions of dollars a year. I believe one estimate from Senior Medicare Patrol has it at about $60 billion per year in Medicare fraud. And what happens is doctors overbill, they bill for procedures they never did, or they double up. And it leads to all of us paying higher healthcare costs because things are getting billed that didn't happen. Now, the scary side of this, and I guess the flip is, they're using AI technology to flag these procedures. Now, while we all are for new tech and innovation and everything like that, there was a whistleblower case a few years ago where people inside insurance companies were talking about how they were using this AI technology in tandem with physicians to just deny claims en masse. And what they would do is they'd have a software that would bring in all these prior authorizations. And the whole point is just like this program where a doctor was overlooking them, but the software allowed the doctors to deny hundreds or thousands of cases at once. That does give me a little bit of cause for pause here. I'm hoping the rollout isn't like that, but just so you guys know, we absolutely need to curb fraud, waste, and abuse in Medicare. It's costing us all billions of dollars a year. It's raising everybody's healthcare costs, but at the same time, this technology is a little bit untested. There could be some issues with it. So we have to see, which is why I'm appreciative that this rollout is small in scope. They're not doing it for everybody. Now, this is going to be limited to 17 procedures, which we'll go over in 6 states, New Jersey being one of them. Now, some of the procedures that are going to be included in WISER, a lot of nerve stimulations are going to be under more scrutiny. I think the biggest one I saw is epidurals. I did notice that I do have a lot of clients who have epidurals regularly, a lot of clients in general with NJ Life and Health. So that is something that is going to add a few more headaches for people. There's some arthroscopic knee surgeries. There's impotence and incontinence. There is lumbar decompression for spinal stenosis. So there are a couple big ticket items. I don't think anything stands out here as something that is a massive, a lot of people are getting it. But at the same time, we do have to be cautious and just know that if you have any of these 17, starting January 1st, you might have to deal with a little bit more headache. What does this mean for you if you're a Medicare enrollee in New Jersey? The truth is, most people are not even going to notice a change. You know, there are thousands of procedures you can get done with original Medicare without any hassle. They're adding 17 to the list of ones that you might have hassle for. So you're probably not even going to notice this. You're going to read this article we have, you're going to watch this video, and in 2026, you're probably not going to deal with any headache. Now, if you need any of these 17 procedures, the way it is your provider can either look for prior authorization ahead of time, or they can do the procedure and then look for prior authorization after the fact. It's called post-service review. So we're hoping this is very streamlined. We're hoping that the experience people have on original Medicare is largely the same, because we're going to transition to this next section. One of the things people love about original Medicare is there's pretty much no prior authorization. So a lot of people are worried, like, does this make original Medicare not as advantageous? And I would argue no. If we look at the exact numbers, and this is from Kiplinger and Kaiser Family Foundation, 2 amazing journals and publications, there were about 400,000 prior authorization reviews for original Medicare enrollees in 2023. There were 50 million prior authorizations for Medicare Advantage enrollees in that same year. Even with these additional 17 prior authorization requirements, it is still likely that Medicare Advantage is going to have far more prior authorizations. We're not saying original Medicare is better than Medicare Advantage or vice versa. That is always a decision that is up to you. It's based on your health, it's based on your area, because the plans vary so much state to state and the costs vary so much state to state. But it is just something to think about. If you want to work with brokers who stay on top of the Medicare news so you are never blindsided by anything, you can work with the brokers here at NJ Life and Health. You can call our Toms River, New Jersey office at 848-226-6897 or visit our website, www.njlifeandhealth.com. You'll get a one-on-one call with a broker that is going to work with you for life. We want to make sure that year over year, there's no surprises, that you know exactly what you need to know for your specific health, for your specific financial situation, for your specific area, and that you have the coverage that you deserve. So let us know in the comments, are you worried about more prior authorizations being added? Do you think it's a good way to combat fraud, waste, and abuse in Medicare? Do you like Medicare versus Medicare Advantage? What's your take on that? So please like and subscribe, leave us a comment below, and we'll see you in the next video.